Hello everybody, my name is Navaria and I'm going to be going over how to properly check your own blood sugar. Blood sugar is what plays a major role in diabetes. A normal blood sugar should be anywhere from 80 to 120. So when checking your blood sugar, you're going to want to check your blood sugar throughout the day if you are diabetic or pre-diabetic. So typically before breakfast, before lunch, and before dinner, and at bedtime. So if you're in a long-term care facility or in a hospital setting, typically the nurse will go around, check your blood sugar before each meal, make sure that it's in the proper range. If it's not, then in the computer or in your medication record, it will also notify the nurse how much insulin she is to give you based off of your blood sugar. And that's just to help to bring those blood sugar levels down. Now, the first thing that you want to do before you check your patient's blood sugar would be to wash your hands. But for the purposes of this video, we're going to be using a small amount of hand sanitizer. And you'll just want to gently rub that in your hands, interlocking it between your fingers, and just kind of wait for that to dry. But if you were in front of a sink, you would want to wash your hands. The next thing you're going to need is a pair of gloves. Also a glucometer, and this is what is going to be telling you the amount of your blood sugar. Now, if your blood sugar is over 600, the machine will just read high, and at that point, you would want to go back, check your patient's ranges, either stick them in a different hand using a different finger. If it's still reading high at that point, then that's when you're going to want to notify your CNP, which is a nurse practitioner, or your doctor, whoever's on call, and get further instructions from them. The next thing you're going to need are your testing strips. So inside, it usually comes with 50 testing strips in the inside. And these are particular to this machine. And what you would do is you'll take your testing strip and you'll insert it into your machine. And once it's ready, then it'll start flashing I don't know if you guys can see that. It'll start flashing like with a picture of the testing strip and a droplet of blood, just letting you know that this machine is ready for you to use. So that is good right there. So the next thing you want to do is you're going to want to knock before you go in the room, identify yourself, and also identify the patient to make sure that you're testing the right patient, because once you get this patient's blood sugar, you could be potentially giving them insulin, and you don't want to give the wrong patient insulin because they could potentially die. So the first thing that I'm going to do is put my gloves on, and the next thing I'm going to do is pick up an alcohol swab, and I am going to gently wipe my patient's finger with the alcohol swab, and I'm going to let that finger dry without fanning it. Once that finger dries, then I'm going to take my lancet, which is a small needle, and I'm going to poke my patient in the finger, particularly the palm of the finger, the bed of the finger. And then once blood draws, sometimes you may have to squeeze a little bit depending on how cold your patient's hands are. And once you get that droplet of blood, then you're going to wipe that first drop away. And then you're going to squeeze again, drawing blood. Then you're going to take your glucometer that is ready and flashing, and you're going to insert the droplet of blood into the glucometer. Okay, so then the machine will typically start counting down from 5. You'll sit your machine down to the side. You'll take your alcohol swab and gently clean your patient's finger again. And then you will throw that in the trash. Our glucometer is ready. It says that my blood sugar is 119. And if I'm a patient that has a set amount of insulin that's supposed to be given to me, maybe 8, then at that point, me as the nurse, I would go back to my med cart and I would draw up 8 units of insulin and give them to my patient. If it says, if my medical record says that at that point, with me having that blood sugar, that I don't get any insulin, then I would not give my patient any insulin. But that's just for another topic, but that's just typical scenarios of what you would do if that did happen. However, all in all, that's all that goes into checking a blood sugar. You do want to be mindful and make sure you're going to your yearly appointments, getting your physicals, checking up on yourself, because diabetes can be a slowly killer. It's important to know your numbers. You can go blind because of diabetes. You can lose fingers, toes, and potentially your legs if you don't take care of yourself with this particular disease. Also, I hope you guys enjoyed my video. And if you have any questions, comment down below, subscribe below, and thank you for watching my instructional video.